All right, so here we are in our right knee. Here's the ACL. We're on the medial border. We're developing a view of the medial eminence, which is often maybe osteophytic or prominent. And we're trying to eventually either do a meniscal transplant in the appropriate patient or perhaps a posterior horn root tear repair. So we're going to talk about using the PoweRasp to finish off in a controlled fashion the medial wallplasty right along here where this shaver is right now, and then also an eminence plasty. So now we're going to take the PoweRasp, and it is a nice linear oscillating rasp that goes on the standard shaver handle that works in a forward direction. You'll see the blades as we bring them into this enlarged portal. You can see the teeth are in one direction. So here we're going to work on the wall first in a forward mode, and then literally can go back and forth and just pretend it's like a Dremel tool and just kind of PoweRasp this bone off in a very controlled setting. So it's got enough space between the shaver sleeve and the rasp to create extraction of the bone products that we're removing. You can give this notch what I call a high and tight. Tight up against the posterior medial PCL and tight up against the ACL without hurting it for the eminence. So I'll do the wall first from front to back, and you can go back and forth. We're gonna focus mostly on the wall right now. It really is like a fine-tooth, well-controlled burring in planar mode with your wrist motion forward and back, so there's no chance of slipping off. So I can get right up on myself and do a controlled resection. So you can see we've really resected a significant amount of bone, easier to see back here, and you're starting to be able to see the posterior horn. We can go right up to the PM bundle of the PCL. So here you can see the nice effect we have now. We've safely opened up this medial wall. Now we'll work on the eminence. So I'm just aiming down around the safe part of my ACL right here. You can feel the eminence right here. I'm on it. So I'm getting a good hand position to control it. That's bone right below me, and there's ACL right there. You can see the fibers. So I'm safely right next to it, but I know the motion's this way, so I'm not going to cut any fibers, but I'm going to, in effect, lower the floor and increase the space to be able to get to the back of the knee. So here we go. There, now we've really lowered it without hurting a single fiber of our ACL. But we've got all this space to work back here. And lo and behold, there's the posterior horn of our meniscus. We couldn't see it before, but now we sort of own it. We can get any instrument around it. We can get a lasso around it. We can get a meniscal scorpion. I can get a shaver back here, an Apollo to breed the remnant of the horn to do a meniscal transplant. Everything's open for possibilities, including confirmation that generally our posterior horn bone plugs for a PCL are about an 8 or 9. So you want to be able to know inflection. Go ahead and flex that down. Flexion valgus, there we go. That this will easily get back here. I'm going again through the lateral portal, which is key because now I can get back here and put a posterior medial portal in over that ubiquitous fold right up there, come in with a spinal needle. So we'll take this in through the medial portal again. We just raise our hand up, and we can take off that plateau osteophyte that often happens there in chronic root tears and just burr that down. So here we've just successfully burred it off right there in the corner. It was right here. But you wouldn't want to put the meniscus right back down to an osteophyte. So you'd want to burr it off. But you can also take the PoweRasp oftentimes from the back of the knee through your cannula and come at that osteophyte right directly like this. PCL is to the left. You're in line with the PCL fibers, oddly enough. So we're just knocking off that osteophyte right there and burring it down, getting ready for the root repair. So there we've trimmed that corner osteophyte down with the sharp teeth of our PoweRasp in a controlled setting in a very tight position, but this gives you controlled volumetric extraction of bone without bouncing all over the place. So now we'd get our scorpion in there and do our root repair in a standard fashion.